The following medical segment is brought to you by Aurora BayCare Medical Center. Here's Benny Peterson.
We are here this morning with Dr. Michael Schnaubelt, a board-certified orthopedic surgeon at Aurora BayCare. Dr. Schnaubelt, today we are talking about the latest techniques for hip replacements. Can you tell us what makes someone a good candidate for a hip replacement?
Sure. Patients that we're looking at doing a hip replacement have failed traditional techniques for treating them, such as anti-inflammatories, ibuprofen, drugs like that. They've also typically failed physical therapy, cortisone shots, things like that. And it's people that have degenerative arthritis, generally speaking.
And you offer innovative procedures such as anterior hip replacements. Can you tell us the advantages of having an anterior hip replacement versus a traditional hip replacement?
Sure. So an anterior hip replacement, anterior means from the front, so we make the incision right in the front of the hip here. The traditional hip replacement is done from the back, and it goes right through the gluteus maximus muscle and several smaller muscles on the way. So it's a lot more invasive. There's more muscle pain, longer recovery with a traditional hip. So the anterior hip, we can do it much faster in terms of the recovery and getting patients back to work sooner. They often go home the same day. We can do both hips at the same time. There's less restrictions on their movement and the range of motion after surgery, and folks tend to recover much quicker.
And what can a patient do to prepare themselves for an anterior hip replacement?
So the better shape people are in, obviously they're going to recover that much easier. People that are more sedentary, we like to get into a prehab or a preconditioning type program with therapy. We also like them to stop smoking. If they're diabetic, we also like to get their blood sugars under better control.
All right, thank you, Dr. Schnaubelt. So for more information on Aurora BayCare's specialized orthopedic teams, head to aurorabaycare.com/ortho. And Good Day, Wisconsin. We'll be right back.